I'd like to call this meeting of the House Insurance Committee to order. Alia, please read the roll. Take the roll. Here.
Rep. Apney, Rep. Brennan,
Designation.
Cephas,
Designation.
Gergley,
Designation.
Haddock,
Designation.
Kozarowski,
Designation.
Malagari, Mirsky, Monroe,
Designation.
Parker,
Designation.
Scott,
Designation.
Venkat, Warren,
Designation.
And here online.
Thank you.
Chair Pickett,
Here.
Fink, Kutz, Ledbetter, Nelson, Mahalik,
Designation.
Miller,
Designation.
Olsummer, Rader, Zimmerman, Rowe.
Thank you, Alia. We have a quorum. Good morning, everyone. First, I'd like to welcome our newest member, Representative Olsummer, to the committee. Representative Olsummer has experience as an insurance producer that will be valuable to this committee. We look forward to working with you. Chair Pickett, do you have opening remarks?
I too would like to welcome you to our committee, Representative Olsummer. We look forward to working with you. You are a fine addition to our group. Thank you.
Thank you. Thank you, Chair. The first order of business is consideration of House Bill 1754. Chair Pickett seconds. Alan, please explain the bill.
House Bill 1754 amends Act 284, the Insurance Company Law, and creates Section 635.9 to require health insurers' policies, Medicaid and CHIP, to provide coverage of biomarker testing. Coverage applies if it is for diagnosis, treatment, appropriate management, or ongoing monitoring of the enrollee's disease or condition when the test is supported by medical evidence. Screening is not a covered service.
Thank you, Alan. We have the prime sponsors of the bill, Representative Mullins and Leader Cutler, here with us today. Would you like to say a few words on the bill, gentlemen?
Good morning, Madam Chairs. Appreciate so much you allowing us to say a few words, and of course for moving this critical piece of legislation that I'm so proud to have crafted alongside my friend and colleague, the Minority Leader, Brian Cutler. It's worth the anecdote that since through his various leadership roles since I've been a member, he always took great time and attention personally, however busy the session day was, to look down and text me wherever I was in the chamber and ask how my father, who was battling ALS, was doing. And Representative Cutler knows the tragic deal about that dreaded disease as well, given the losses he's endured. This piece of legislation is, I'm proud of its disease-agnostic nature in that biomarker testing, this cutting-edge ability to look into treatments and diagnoses far earlier than was ever perhaps available, will be a covered benefit thanks to our work today and hopefully the work of the House and Senate going forward. And it will prove so beneficial for cancer patients and for those with a host of diseases, much like ALS and other neurodegenerative diseases. It's worth noting just for a moment how much work goes into getting a bill to this point. And that's where I have to give such a critical shout out and debt of gratitude to the advocacy organizations, the Cancer Society, the ALS Association, Parkinson's, and the list of advocates goes on, as they know their patients, current and future, could benefit. Also to the Insurance Committee, who in exceptionally good faith continue to come to the table, many of them already offering or covering biomarker testing as a covered benefit, continuing to come to the table and engage with Representative Cutler and I, as well as staff. And then we get to staff, who worked so diligently to keep this proposal alive and to find the critical path forward, and that is compromise and a piece of legislation that could withstand a committee vote and the test of law, and then go on and benefit and impact lives. So on behalf of every advocate who's ever come by my door, and for those of us dealing with loss or a devastating diagnosis, I'm so grateful for your time and hopefully your vote today. Representative Cutler.
Thank you, Madam Chairs, members of the committee. I too would like to echo the thanks for all of the work that's been put into this, both at the staff level and from many of the advocates who are in the audience here behind me today. One of the things that I consistently ask new members is to share your story, why you're here, what you're advocating for, and really what drives you and what engages you. And in this particular case, Representative Mullins and I's lives and stories intersected when it came to Lou Gehrig's disease, or ALS. But as he pointed out, this is a disease-agnostic bill, which I think is very important, because as technology advances, it's very important that we keep our laws up to date with where technology is at. That is something that, admittedly, we do not always do well, because the courts, on one hand, require us to be very specific. However, technology waits for no one. And as medical advances are made, and in this case, with the biomarker studies, I think it's appropriate that we update the laws from time to time to represent those kinds of advancements. The possibility of treatments going forward and better delineating exactly what will work and what will not work is as important as even understanding what your initial diagnosis is, mainly because as policymakers, we are tasked with maintaining a healthcare system that we all recognize is very expensive. So it's important that we spend the money and that it is best directed where it needs to be. And this kind of technology is what allows the doctors to make the appropriate kinds of treatment decisions. So I want to echo, again, the thanks to everybody who was involved. This is obviously a very personal issue for both of us from a family level, but it's also very important from a policy level because of where our Commonwealth is, where our age demographics are, and many of the healthcare issues that we'll be struggling with over the coming decades. I would certainly appreciate an affirmative vote and happy to answer any questions that you might all have.
Thank you for your comments. Any questions for our guests today? All right, gentlemen, thank you so much for your comments. We will be moving forward. There is one amendment to this bill. Representative Pickett offers Amendment A04587. I second this agreed to amendment. Alan, please explain the amendment.
This is a gut and replace technical amendment that delineates subsection A, coverage of biomarker testing for insurers, and subsection B is coverage for CHIP and Medicaid. The contents of the bill are kept intact.
Thank you. Any comments, Madam Chair?
And thank you, Madam Chair. There are no further comments from me on the amendment, but I do ask for an affirmative vote. Thank you.
Thank you. Is there any discussion on the amendment? Are there any negative votes on the amendment? Hearing none, Amendment A04587 is amended into the bill. I move to report House Bill 1754 as amended. Chair Pickett seconds. Any comments, Madam Chair?
And thank you again, Madam Chair. Biomarker tests are used to determine which treatment plans are most effective for the type of disease or cancer the patient is battling. We are blessed to live in a time where modern medicine and technology can do such amazing things. I want to thank Leader Cutler and Representative Mullins for speaking here today and sharing your stories and for your advocacy. And I do ask for an affirmative vote. Thank you.
Thank you. Is there any discussion of the bill? Any discussion from our members? Are there any negative votes on the bill? Hearing none, House Bill 1754 is reported from the House Insurance Committee unanimously. Congratulations, gentlemen.
Thank you, Madam Chair, as members of the committee.
The next order of business is consideration of Senate Bill 739. Chair Pickett seconds. Thank you. Alan, please explain the bill.
Senate Bill 739 amends Title 40 insurance and requires health insurers, medical assistants, and the Children's Health Insurance Program to provide for coverage of telemedicine services. Telemedicine is defined as the delivery of healthcare services to a patient who is at a different location through synchronous and asynchronous interactions or remote patient monitoring, and the exchange of information must be HIPAA compliant. And finally, an insurer and government program shall pay for medically necessary services provided through telemedicine, and a health insurance policy may not exclude a healthcare service from coverage solely because the healthcare service is provided through telemedicine.
There is one amendment to the bill. I offer Amendment A04588. Chair Pickett seconds. Thank you. Alan, please explain the amendment.
A04588 is a technical cleanup amendment.
Any comments, Madam Chair?
Thank you, Madam Chair. No comments on the amendment, but I am very supportive.
Is there any discussion on the amendment? Are there any negative votes on the amendment? Hearing none, Amendment A04588 is amended into the bill. I move to report Senate Bill 739 as amended. Chair Pickett seconds. Any comments, Madam Chair?
No further. I'm just happy to say that we are seeing this good bill move forward, and all sides are able to agree with it, so I thank you for that. I'll be supportive.
Thank you. Is there any discussion on the bill? Representative Venkat.
Thank you, Madam Chair. I also am glad that we're moving forward with this legislation. As a practicing physician, I do know the value of telemedicine. I do want to raise to the committee, though, that I think we are going to be revisiting this issue at some point in the near future because the bill does not take into account out-of-network telemedicine care. And this is something that we are going to see, and we see every day in practice. As an example, someone who shows up at a small rural community hospital with stroke-like symptoms and a telehealth consult is initiated, and it is done by an out-of-network neurologist who is providing recommendations as to whether the patient needs transfer or other interventions. My reading of this bill is that it is largely focused on in-network telehealth, which is obviously critical, and I will certainly vote for the bill. But as structured now, we are relying on the Federal No Surprises Act for trying to resolve payment disputes for out-of-network care, and I don't know that that is the path that we want to take in this state. So I would urge us, either in this session or in future sessions, that we revisit that issue. But I do support the bill as drafted because I think it is a positive step forward.
Thank you, Representative. Any other discussion on this bill? Are there any negative votes on the bill? Hearing none, Senate Bill 739 is reported from the House Insurance Committee unanimously. The last order of business is consideration of Senate Bill 1092. Chair Pickett seconds. Thank you. Alan, please explain the bill.
Senate Bill 1092 amends Title 40 insurance to further provide for when an insurer or an insurance producer can offer inducements and value-added services.
There are no amendments to this bill. I move to report Senate Bill 1092 as committed. Chair Pickett seconds. Any comments, Madam Chair?
And thank you, Madam Chair. No, I have no further questions or comments, but I am asking for an affirmative vote. Thank you.
Thank you. Is there any discussion of the bill?
Madam Chair,
Yes, Representative.
I'd like to request a conflict of interest ruling from the chair. I'm a licensed insurance agent in the Commonwealth of Pennsylvania. My company participates in types of promotional programs under consideration in Senate Bill 1092. I would note that the legislation would impact me no more or no less than any other licensed agents in Pennsylvania. Nevertheless, I would like a ruling from the chair on my ability to vote on this legislation. Thank you.
The chair thanks the representative for the inquiry about a conflict of interest. The chair finds that the representative is likely a member of a class of individual who may or may not be affected by the legislation and therefore may vote on Senate Bill 1092. Thank you. Is there any other discussion on the bill? Are there any negative votes on the bill? Hearing none, Senate Bill 1092 is reported from the House Insurance Committee unanimously. There being no further business, this meeting is adjourned. Thank you, everyone. Thank you, Representative Nelson.